Hello and welcome to our presentation. Today we're going to talk about how Indigenous people experience poorer social and emotional well-being outcomes than non-Indigenous Australians, therefore contributing to a high or very high level of psychological distress with increased rates of intentional self-harm amongst young Indigenous people. Aboriginal and Torres Strait Islander Australians make up to 2.5% of the Australian population, and until now, these Indigenous people experience poorer social and emotional well-being outcomes than non-Indigenous Australians, which contribute to a very high level of psychological distress and increased rates of intentional self-harm amongst young Indigenous Australians. Indigenous Australians are more likely to have a better health outcome if rates of financial income, education levels, and housing circumstances are improved. These factors contribute to an impact of Aboriginal health issues which include psychological distress, self-harm, and suicide. For example, the housing issues contribute to the Indigenous individuals' experience of social disadvantages, as Indigenous Australians' rates of homelessness are 14 times higher than non-Indigenous Australians in 2011. The education has improved, as in Indigenous individuals aged 20 to 24 with a Year 12 qualification or higher has increased from 47% in 2006 to 54% in 2011. With income and employment, 5% of non-Indigenous Australians were unemployed, in comparison to 17% of Indigenous Australians. Aboriginal and Torres Strait Islanders have traditionally viewed health as including not only the physical health of the individual, but also social, emotional, and spiritual well-being of the whole community. This plays an important part of the Aboriginal and Torres Strait Islanders' sense of identity and therefore their mental health. Since the colonisation of Australia, many Indigenous people suffer with increased levels of distress and mental health problems due to loss of land, culture, and family. The Australian Bureau of Statistics states that between 2012 and 2013, around 30% of Aboriginal and Torres Strait Islanders that were 18 years and over suffered from a high psychological stress. Indigenous adolescents with increased psychological distress commonly suffered with increased levels of stress. They suffered from increased significant life events, and therefore are at a higher risk of self-harming and committing suicide. Although there are more services available to Indigenous people at present than there was in the past, these rates are significantly higher than previous years, which could mean that these services are not being utilized or are not being effective. Suicide can have a domino effect, triggering further suicides and or self-harm, and therefore increasing psychological distress within families, which will increase rates of further self-harm and suicide. The following graph shows the impact psychological distress has on the Etsy community. The graph below demonstrates males that have a higher or psychological distress by Indigenous status and age. As you can see, the graph shows all males 18 years and over have a significantly higher rate of physical distress compared to non-Indigenous Australians. The next graph shows the levels of female distress in the community. 18 years and over, all females that are Aboriginal and Torres Strait Islanders have a very high level of psychological distress compared to non-Indigenous Australians. Now, these can be caused by loss of land, community, and level of education. Different approaches have been adopted to address this topic of social and emotional well-being. The first step is being aware of the culture. This will help you understand why a person feels like the way they do. Programs such as the Mental Health Program at the Geraldine Regional Aboriginal Medical Service has reduced the amount of people that have been admitted with mental health issues by 58%. There are companies that are educating people about leadership and governments which will support Indigenous communities to grow strong leaders who can then lead and educate others to build a stronger community and support each other. These programs which have been implemented are currently working as governments are working to close the gap of difference of healthcare provided to communities in the rural area. Implementation of any health program into the Indigenous community to assist with the health and well-being of people can be a difficult process. In the past, strategies and/or programs have been developed with little to no input from the Indigenous community. Misunderstandings or limited knowledge of how Indigenous people view the health and well-being of the community has led to program developments that have shown lack of regards of the Indigenous people and resulting in many of these strategies not being successful. Over the years, developments of framework agreements with Aboriginal and Torres Strait Islanders health and joint planning forums have been incorporated to increase a better outcome for the Indigenous people. Strategies that are based on social determinants of health and that consider social and economic perspectives to help promote healthy changes and behavior and better outcomes have shown increased successful results. Programs of holistic approach that focuses on recovering and healing the Indigenous people and ones that give the Indigenous people back control over their own lives seem to be the best form of help with greater positive results in the end. In conclusion, it can be said that the Indigenous population still face poorer outcomes which lead to high level of distress and self-harm compared to non-Indigenous population. However, the government and communities are working on trying to close this gap and reduce the level of distress in the community. Some of these community programs have worked, and there are future programs that have been put into place to close the gap even further. So let's get together and close this gap. Thank you for listening to our presentation, and have a good day.